Hello, my name is Elliot Paz. I am a teaching assistant at Montana State University Northern. And for today's lecture, we're going to go over Chapter 5, Health, Law, Policy, and Ethics out of the textbook Public Health 101, Improving Community Health by Richard Riegelman and Brenda Kirkwood. And the objectives for today's lecture, we're going to be explaining the scope of health law, policy, and ethics, discussing the national initiative known as Healthy People, identifying key legal principles that form the basis for public health law, identifying the four types of law, discussing and illustrating the concept of health and all policies, explaining the differences between market and social justice, whilst illustrating the potential tensions between individual rights and the needs of society using public health examples, describing the role of advocacy in public health, identifying principles of public health ethics, discussing key principles that underlie the ethics of human research, and discussing policies aimed at preparing for and for responding to pandemic diseases. All right, now to kick things off, what is the scope of health law, policy, and ethics? Health law and policy are central tools society uses to regulate behaviors across individuals, groups, and populations. These frameworks aim to promote access to care and ensure quality, equity, and cost effectiveness. Health law and policy also address the organizational and professional structures responsible for delivering care. They help define the roles and responsibilities within the healthcare system to maintain standards and improve outcomes. And health law and policy are essential for achieving key public health goals. So these tools focus on anything occupational safety, road and drug safety, and managing various disease threats, thus contributing to the overall well-being of the population. Now the components of health law, policy, and ethics. They are healthcare, which is focusing more on the treatment side, public health, which is focusing more on preventative steps, and then we also have seen what is the emergence of bioethics, which acts as a key field at the intersection of healthcare and public health. It focuses on applying moral principles or values to areas of potential conflict. Bioethics addresses controversial issues such as stem cell research, which results in the destruction of embryos, and end-of-life care, by aiming to align public values with health policy decisions. All right, now what I have here is Table 5.1, which outlines the core components of health law, policy, and ethics, which are healthcare, public health, and bioethics. And each component is linked to specific issues and challenges that health law, policy, and ethics address. First, starting off with healthcare, its scope focuses on the legal and policy frameworks governing the delivery of health services. So you can see this on issues like access to care, patient rights, and health insurance regulation. Then for public health, it focuses on population-level health concerns and prevention strategies. So you'll see it focus on policies related to disease prevention, environmental health, and vaccination programs. Then for bioethics, it focuses on ethical dilemmas in medicine and health research. So you see him working in controversial topics such as genetic testing, stem cell research, and end-of-life decision-making. And these components work together to address a wide range of issues, from individual rights to societal health concerns. Understanding these components helps in analyzing how legal, policy, and ethical frameworks shape health outcomes. All right, so now what legal principles underlie public health and healthcare? Well, before diving into the specific issues, we need to define the key legal principles and philosophies that shape our approach to public health and healthcare law. These principles provide the foundation for understanding how legal frameworks influence policy decisions related to health. So first, let me talk about our U.S. Constitution. Since the U.S. Constitution is the foundational document that guides public health and healthcare law. However, it does not specifically mention health, which leaves the interpretation of health-related legal issues open to the state and local authorities. Now, public health and healthcare responsibilities are primarily governed by state authority, unless delegated to local jurisdictions such as counties or cities. And as a result, this creates variations in how health policy is applied across different regions in the US. Now, one very important detail. The Constitution allows governments to act to protect public health and provide healthcare services, but it does not require them to do so. All right, so now the use of that authority is what is known as the police power, which allows states to pass legislation and take actions to protect the common good, which includes health and safety. This authority to protect the common good can justify a wide range of state actions, such as regulating healthcare professionals and facilities, establishing health and safety standards in workplaces, implementing measures like seatbelt laws, vaccination requirements, and tobacco product restrictions. However, this power is limited by individual rights, as defined by the US Constitution, state constitutions, or laws passed at the federal and state level. Now, one thing we're going to bring up is what we call the Interstate Commerce Clause, or ICC, and the federal authority. So the Interstate Commerce Clause provides the federal government with authority to regulate public health and healthcare by enabling them to tax or regulate interstate commerce. Now, this has been used to justify federal involvement in healthcare, such as establishing nationwide healthcare standards and funding. Federal authority can be exercised by offering incentives to states, such as matching federal funds to encourage specific actions like lowering blood alcohol content for DUI laws. All right, so now going over individual rights. The US Constitution explicitly grants individual rights such as freedom of speech, the right to bear arms, religion, and assembly, as these are clearly laid out in the document. Inferred rights are also recognized, even though they aren't explicitly stated in the Constitution. These rights often are based on interpretations by the Supreme Court. So examples of these inferred rights can be privacy, so the right to make personal decisions, such as the use of contraception, and bodily integrity, which protections against unnecessary medical interventions. These inferred rights can limit government's actions, such as quarantine measures and travel restrictions during public health emergencies. Now, the existence of rights implies that courts, both state and federal, are expected to uphold and enforce these rights. If a right is recognized, it must be protected in legal contexts. Now, if the Constitution doesn't explicitly define a right, or if the Supreme Court has an inferred one, then no such right exists. However, federal and state legislatures have the authority to create rights, such as the right to education or access to medical care. Okay, so now we're going to go over health policy. What do we mean by that? Well, first off, it's a subset of a much larger category of public policy. So here, governments and private groups have a considerable amount of latitude in developing health policies, as long as they stay within legal constraints. This flexibility is why the Constitution was left vague or incomplete, because the Founding Fathers knew times would change and new issues that they could not foresee would arise, which gives the people and decision makers they elect the ability to determine what is best for that given time period. Now, when we're talking about law versus policy, the key distinction between law and policy is on who can create each and how they are enforced. A policy can be created by any organization, so private groups, trade associations, and governments, as long as it doesn't infringe on individual rights. Laws, however, can only be created by the legislative branch of governments and enforced through the legal system. Now, who makes public health policy? Public health policymakers are defined by their authority to make decisions that can be implemented. So this includes government officials at the federal, state, and local levels, such as the presidents, governors, and administrative agencies. However, enforcement can be complex, especially when courts like the Supreme Court challenge the power of agencies such as the EPA or FDA to regulate certain areas without specific congressional laws. They can use steps to enforce a rule. They can't make regulations to enforce other laws, such as maybe a smokestack that would be 30 meters. Now, for the private sector, the private groups and professional societies such as the Public Health Association or commercial trade associations also play a significant role in shaping health policy. For example, policies to restrict smoking in hospitals, encourage drug development for smoking cessation, and adjust insurance rates to support these efforts. So now, how are health policy priorities established? Well, so in terms of its health policy, the US places a high priority on healthcare, evident in the significant amount of money spent on healthcare per person. The US spends more on healthcare than other developed nations, both in absolute terms and as a percentage of GDP. On the flip side, less is allocated to social services, such as public education, housing, and nutrition, which highlights an imbalance in how resources are distributed across different sectors. And this discrepancy provides a strong argument for more focus on community health and social services to support broader population health. The US does not have a centralized mechanism for establishing health policy. Instead, various public and private entities contribute to the process. However, the Healthy People Initiative is one example of a collaborative effort led by the US Department of Health and Human Services. It aims to provide a more centralized effort to set evidence-based national objectives for improving population health. So since the 1980s, the Healthy People Initiative has updated a set of objectives every decade to reflect emerging health priorities. These objectives assist in identifying critical issues that require program or policy development, implementation, and evaluation. Now, a new approach, called the Health in All Policies approach, is becoming increasingly popular as a strategy to encourage collaboration across both private and public sectors. The goal is to work together to achieve common health goals and reduce health inequities by taking a holistic approach to health issues. Now, going further in depth on the Health in All Policies approach, is an approach that recognizes the interconnections between various sectors and public health. It advocates for integrating health considerations into policymaking across all sectors, so transportation, education, environment, social services, and more. Now, the World Health Organization, or WHO, emphasizes that the health in all policies is about collaborative governance, bringing together sectors to improve health outcomes and reduce health inequities. The goal is to ensure that policies across different sectors promote well-being, rather than inadvertently causing harm to public health. So some key principles, such as health equity, is ensuring that all populations, especially the most vulnerable, benefit from the policies. Then there's intersectional collaboration, which means working across sectors, so like urban planning and environmental policy, to achieve shared health goals. Then there's sustainability, which is creating policies that lead to long-term improvements in population health. So it implies that the health consequences should be considered in the making in all public policies.